A mammogram is the single most effective way to tell early detection, but it's not the only thing you check, and you really should be doing more. October reminds us that because it is Breast Cancer Awareness Month. Dr. Kobbermann joins us from HCA Midwest Health to talk about how health services can increase your chance of beating breast cancer. So Dr. Kobbermann, you have been working in the area for a really long time, and over the past few years, what have you been telling women about early detection?
Absolutely. One of the best things and the most progress we've made in breast cancer is to be able to identify it early. And the odds and outcomes are so much better if we can find tumors in their earliest stages. And so really the focus is on screening and early detection.
Okay. We got to draw some attention to our centerpiece here.
Absolutely.
You have brought a carton of lemons. So how can they help women when they're learning about early detection in breast cancer?
Absolutely. So all of these lemons are lemons, but they all look very different one from another.
I'm gonna have to pick them up?
Absolutely. They all have their own little lumps and bumps and differences. And that's true about breasts as well. Everyone's breasts have their own lumps and bumps and differences. And the most important thing is knowing your normal. So where your normal lumps and bumps are, what your normal breast skin looks like. And then if you see things that are changes, new lumps or bumps, skin dimpling, skin changes, redness, nipple discharge or bleeding, that you are aware that that's different from your normal.
Right, and that's something so important. Know it first, and then you recognize the changes.
Absolutely, and cancer doesn't just present as a mass. There are other signs and symptoms that may be a signal or a trigger for you to go get additional screening, and it's important to pay attention to those as well.
Okay, so what are 4 things that women should expect before, during, and after a mammogram?
So the important thing is not to be scared. When you go in, you really want to know your family history. So be aware of breast cancer diagnoses in the family, ovarian cancer, but don't just focus on your mom. Also look at your dad's family as well. When you go in, expect a relatively quick appointment. They're going to request that you don't wear deodorant, but if you forget, still go and have your mammogram. Most places have cleansing cloths and things to help you wipe it off. They will generally take 4 views, kind of one from up and down and one from a little bit of an angled side, 2 on each side. If you have implants, it's important to still go in. They will do some additional pictures to kind of push the implant out of the way, but it's still definitely important to get your mammogram. And then you can expect results relatively quickly, usually within 24 hours. You will get a letter in the mail following that as well that indicates if everything looks good or if additional steps need to be taken.
Okay, and with all of the technology and research that's been going on over the past few years, what are the top 2 things that you have seen?
Yeah, so we've made a lot of advances, of course, in breast cancer over the years, but most recently, the 2 big things are really hidden scar technology and the results of the recent TAILOR-RX study. So hidden scar is a great part of the surgical aspect of breast cancer. It allows us to place the incision kind of in a less cosmetically obvious area and to be able to remove the tumor in a way that's less disfiguring. And that has a lot of long-term benefits for patients because they don't have the kind of daily reminder of the cancer. And so that's been very, very beneficial. The TAILOR-RX trial looked at chemotherapy, and it looked at women with early stage breast cancer and kind of tried to identify who needed chemotherapy. There's always been a group that we knew did fine without it and a group that we knew really needed it, but there was this group in the middle we really didn't know what to do with. And this looked at 10,000 women that were in that middle group and really helped us identify that they can do fine without chemotherapy, and that's really been a big movement to kind of being able to offer less kind of therapy that's difficult to undergo.
Dr. Ann, quite a few things you mentioned there really take the fear away from it. Don't be afraid to get a mammogram. Don't be afraid if you do have to have surgery, because we actually have other technology available. Thank you so much for coming on the show today. You can make an appointment for your annual mammogram and get screened. Just visit hcamidwest.com/service/breast care or call 816-823-0011.